Good, and I'm so happy also to see that we have people, as you said yesterday, we have people coming from 9 countries to Sweden. Isn't that a marvelous thing? I mean, and I'm extremely grateful also to be able to present our keynote speaker today. And now I've learned how to pronounce his name. Fausto Pinto, well-known professor in cardiology, former president of both the World Heart Federation and the European Society of Cardiology. Welcome.
Wow. Well, good morning, everybody, and thank you so much, Pernilla. It's really been very enjoyable to be here at the meeting. It's my first time at this meeting, and I'm really enjoying it. And most of all, I think this is the kind of meetings that we need because they have different perspective, they mingle different ways of looking at the same issues. And with that, we all hope that we can find better solutions of all the issues that we all face and in our everyday life, depending on how we work and where we work. I think the common goal is to do our best to overcome all these issues, and today we're going to focus on cardiovascular. Yesterday was on brain health, which was quite fantastic discussions, and I think this is really a unique opportunity to be together with so many different and to know new people, and that's always very, very enjoyable. So thank you very much, Pernilla. Congratulations for putting together this this fantastic meeting, and I hope to be back again. You know, no, I'm just kidding. So I'm going to talk about the Safe Heart Plan. Actually, I have my life. It's a little bit easier because yesterday we already had some hints on the plan and why we need the cardiovascular plan. Actually, many of us we fought for this for many years, and this was is something that didn't happen overnight, as you can imagine. And there were many people, many institutions, many organizations in Europe, the European Society of Cardiology and the each group, which were very much involved. The World Heart Federation also supported, and there was basically some sort of concerted action. And this is very important because that's one of the messages that we heard yesterday, is the ability to work together will make us stronger, and particularly going, and you were talking about leadership, and that show the way, going in the same direction. Of course, we need to find that direction sometimes, and that's where you need leadership to show and to work together to make sure that we go into the right direction. I have no conflicts of interest except the fact that I'm a past president of the European Society of Cardiology, as Pernilla said, in the World Heart Federation, and I'm sitting now also in the board of the NCD Alliance, which is also an interesting organization that puts together all the different NCDs, which is also challenging, but quite relevant for, I think, for the days that we live. Okay, we know these numbers. Just to give you a little bit of the perspective of what we're dealing with. Unfortunately, and I say this very times, this is not the gold medal that I'm proud of, but cardiovascular disease still represents the #1 killer in the world. And in Europe, and particularly now focusing on the EU, we have 1.7 million deaths per year. More than 5 million new cardiovascular disease cases which are diagnosed annually, and we have roughly, and this is always underestimated, about 60 million people living with cardiovascular disease. And the problem that we face in Europe, and of course in other parts of the world, but we are now focusing on the EU, is that we have inequalities. You were talking about equity and equality, and what we can see here, and this is not new also, there is a gradient between East and West and North and South, and there's quite different rates of mortality for cardiovascular disease across the EU, from 20% at the lowest to 65% at the highest. And these population disparities within the different countries, they are also related with age, ethnicity, and very importantly, the socioeconomic status. Today, we talk very much about the social determinants of health, which are becoming more and more relevant in the way that we can understand the impact of different conditions, and particularly cardiovascular. Therefore, the fight for cardiovascular health is a fight for equality, and I would say even more for equity, which I think is very relevant. One important aspect, and this is also sort of a wake-up call, and I see there this poster here, which also highlights the problem, the issue, and fortunately we have now a lot of people also focusing on these aspects, which is about women and cardiovascular disease, and this is the kind of awareness and numbers that really have to be spread so people understand what we are dealing with. We have more cardiovascular deaths in women than all cancers combined. And 40% of all deaths in women are cardiovascular disease, compared with 34% in males. So the mortality rate in women is higher than in males. And the mortality following a heart attack is about 20% greater in women when compared with males. And a very important topic that many of us also have been fighting for many years: women are underrepresented in the clinical research, in clinical trials, for instance. Most of the trials, until recently, there has been some change now, that were basically trials of white males and from the Western world. And this is really something that we also, when I say we, the community that is involved in research, and particularly in the clinical research, is trying to change. And things have changed a little bit, but still, this is an issue. So cardiovascular health action means gender equality, and I'm very much for that. My wife loves this, when I say this and when I support this. Just kidding. Anyway, the other issue here is that despite the fact that we have progressed a lot in terms of managing cardiovascular disease, we have not been very good at prevention, and we heard this yesterday as well, and this is a big issue. We're good at treating, and we cardiologists, we love to treat disease, but the problem is when disease happens and appears, it's a little bit too late. Of course, we treat it, we manage myocardial infarction, we manage stroke, we manage all these different conditions, but we really have to make a huge effort to try. Of course, we all have to die, but it's different if you die when you're 95 or when you are 40 or 50. And this is what we really have to have, this concerted action trying to improve the way we can do prevention. And another important aspect is that, and this is data from 23, EU life expectancy was about 81.5, but there is an 8-year gap between the highest and the lowest countries. So we still have quite, and I've shown this before, but this is quite important. And the other thing is, although women live longer than men, you know, they're much more cautious, and they have, no, I'm just kidding. But anyway, the problem is that the extra years, so the years the so-called healthy life years, they are the same, about the same. And then what really differs is that years lived with disability, they are higher in women than in men, because, and this is very important. So it's not only about living more, but how do you live? And again, this was discussed a little bit yesterday, and this is something that actually we have to worry about and make sure that we extend life, but we extend good life, a healthy life. And this is something, of course, that we have to deal with. So we can say that we have a cardiovascular crisis in the world, but now we are focusing in Europe. And here we I basically summarize what I've been mentioning before, adding also here, and we have some health economists here today, the burden in terms of the annual economic burden represents close to 300 billion euros in the EU space regarding, it's about 2% of the EU GDP, which is quite substantial. And this is even more relevant when we're talking about a condition that in reality 80%, and this is an estimation of course, but we do have some data to show that about 80% of cardiovascular disease is potentially preventable. And we are spending this amount of resources that of course could be used in many other things to improve our life for something that is potentially preventable in about 80% of the cases. So it's quite remarkable. Now, the other thing, and I like this slide, was shown by my colleague Susanna Price, who's the Vice President now of the ESC. And this shows also some, we're talking about equality and equity, some inequality that we have observed over the years. This is the difference between, and again, very important to support cancer research, but when we compare the amount of resources that are put into cancer research and cardiovascular research, you can see the difference. Now, the other thing, which is here, you may not see it so well, but it basically, this is US data, and this shows US healthcare cost versus US venture capital funding of novel drugs and in highly prevalent chronic diseases. Cancer, so this is the US healthcare cost. So the highest cost, cardiovascular disease. The highest venture funding, cancer. So again, showing these disparities that I think it's important at least to understand, what is happening. There are many reasons we could discuss a lot of things about this, but this is the reality. And this again is something that we have at least tried to improve a little bit, trying to expand a little bit the amount of support. And that's part of the plan also to look into this. So it's clear that we needed a plan. And it's clear that we need a plan that can tackle many of the issues that I've shown here, and we were all very happy when the EU Safeguards Plan was approved, was unveiled on December 16th, so it's brand new, it's a baby on of 2025, and it's the first ever EU-wide strategy which is dedicated to cardiovascular disease. I've been in this business for about 30 years. I graduated 40 years ago, and I've been involved more in this type of things for the last 30 years. I still remember when cardiovascular medicine or cardiovascular sciences did not exist, in the EU or in the forum that would be talking about research support and that kind of thing. Cardiovascular disease did not exist. So this is a huge achievement for, I would say, for the society and for the community. This is part of the European Health Union initiative. It's comprehensive and it's a life course approach. And this is very important. We are dealing with the life course strategy. This is not something to do in a couple of days or a week. We are not God. So it's something that really has to be, and this is difficult for politicians, we know that, because of course they want to have short-term results. And we may have some short-term results in some areas, but the whole process, it's a lifelong approach that has to be done. And an important aspect, it focuses also on vulnerable populations, particularly children, women, and persons with disabilities. And this is actually one of the highlights regarding children and young people. There are stronger rules on advertising. There's a toolkit for child and adolescent health and mental well-being promotion. And this is certainly something relevant also in those days. There are 3 strategic pillars in the plan. Very simple. 1 on prevention, so health promotion and reducing risk factors, and I will detail a little bit more. 2 on early detection, and again, we spoke a little bit about this also yesterday, screening and identification, and 3 on treatment and care, quality care, and rehabilitation. So let's focus on prevention. As I mentioned before, nearly 80% of cardiovascular conditions are preventable through different things, but particular lifestyle changes, which is very difficult, we know, and that's why we have to be smart on developing strategies, how people can actually be engaged. Because it's not just saying don't smoke, walk, do exercise, don't eat properly. That doesn't work. So we need to have proper strategies that can actually be appealing to the population. And of course, this is something that has been discussed, and many strategies are being thought of. But here we're focusing on reducing tobacco and alcohol use, promote healthy diets and reduce processed foods, very important, this aspect, increase physical activity, and then addressing obesity at population level, which is a big issue also, as we all know, in the world, but in the EU we also facing this kind of issue. The second pillar, so early detection and the screening, some important aspects. One of them is the EU protocol on health checks. And this is something that we've been promoting for many years. So there's a common approach to cardiovascular disease, diabetes, dyslipidemia, and obesity screening. And again, this is being developed during this year. Expansion of screening in primary care and community settings. This is the proper place where this can be done at a larger scale, and that's important if we want to have results. And then, of course, digital tools and registries for early diagnosis, and also focus on preventing disease progression than when it already is there. And finally, the third pillar, in terms of treatment and care, there's a European network of cardiovascular health centers. This is very important because it can improve the way we can address some of these issues. There's an integrated person-centered care pathways. Access to innovative treatments and medical technologies is not only to have the new drugs, the new devices, the new procedures, is to have access to those. And this is something that, of course, if people don't have access to all these innovations, the innovation, it's useless. And that's something that we have to improve. Strengthen cardiac rehabilitation programs. This is a problem that we are facing again all over the world, but in Europe we have issues, significant issues in terms of cardiac rehabilitation. We have data, for instance, from the InterAspire or the EuroAspire study, which is these are large studies looking at different countries, and the percentage of patients who had indication for cardiac rehabilitation in the last InterAspire study was about 9% overall, with differences. Here in Scandinavia actually is not so bad compared with some other countries, like some of other countries in Europe. And finally, AI-supported clinical decision-making, also very relevant. Now, let me flagship here this initiative, the EU Cares for Your Heart. It's a lifelong, personalized, and digitally enabled prevention program. Support member states in developing national cardiovascular health plans by 2027, and this is fundamental. You know, this will only work if the different countries, because as we know in Europe, health is an issue that is outsourced, if you will, to the different countries. So it's a responsibility of each country. So it's very important that each country has a national, translates this plan into a national cardiovascular health plan, and I guess we're going to discuss that a little bit more in detail. And some countries already have in place, some are developing it. And the goal is to have these plans done by 2027. Develop personalized tools and approaches for individuals, and of course digital health tools for self-management. Some additional key initiatives very relevant in the plan. Food transparency, very important, empowering consumers through information on food processing. This is a big issue that we really hope we can improve. Tobacco control. We know that we are facing a major push from the tobacco industry with the vaping and all these kinds of e-cigarettes and so on. This is wrong, and this is something, I know there is some differences even in some countries that are a little bit lighter addressing this issue. There are very strong statements from organizations such as ESC, ACC, AHA, and many others. You know, we should be completely, tolerance zero to this kind of promotions and this kind of things that actually are affecting our populations. And then, of course, financial mechanisms, and this is very important, of course, exploring tools to fund public health actions. And this is something that needs to be also addressed very, very objectively. Then there's going to be an important development, which is this dashboard. So there's a cardiovascular disease inequalities dashboard. It's going to monitor the disparities across regions and populations. We need data, and we need to see how we are doing. So I think this is an important also development or initiative. There is this initiative of the 20 million AI incubator, and the goal is to have an accelerating digital innovation to promote and accelerate digital innovation in cardiovascular care. And then, very importantly, also becoming more and more relevant, the immunization strategy, which addresses the link between cardiovascular disease and respiratory infections. Actually, it's one of the pillars now in some of our guidelines is actually vaccination, particularly against influenza, very important in the cardiovascular field, believe it or not. But it's now one of our main topics. So if I would summarize what I think are the main aspects in this Safeheart plan, which of course is very comprehensive, and I'm just giving you here some flavor. Again, the EU Cares for Your Heart, very important to implement national cardiovascular health plans. The introduction of a EU protocol of health checks for early detection. The proposal for a new cardiovascular disease inequalities dashboard to monitor these disparities. Explicit reference to familial hypercholesterolemia and Lp(a). This is very important. And we have here actually the CEO of the FH Europe, which has been working together to promote this kind of development, because we know this affects quite a substantial number of people that need to be early diagnosed and early identified to do proper management. And finally, digital innovation framed as a cross-cutting priority. There are some ambitious targets for 2035. 25% reduction in premature mortality compared to 2022. The goal is to have in adults between 25 and 64 years, 75% of these adults receiving annual blood pressure measurement, and over 65 years old, 90% receiving annual blood pressure measurements. And 65% of adults get annual cholesterol and blood sugar screening. So these are some of, I would say, ambitious targets for 2035. Let's see how we will manage this, but of course we need to develop, implement the strategies to do it properly. And then it's tackling health inequalities. I've shown you the disparities across Europe, these geographic disparities, these gender differences, very important, the socioeconomic determinants of health, and access gaps in rural and underserved regions. And this is something that also the plan is addressing, and this is something we have to tackle in our society. It's leveraging the digital innovation, very important. These are the current days. This is what we have to deal with. Use properly the tools that we have available. Artificial intelligence for clinical decision support. It's being used already, but this has to be promoted. Telemedicine, which also is being used to improve access to care. Connected devices for patient self-management, and data integration for better research and monitoring. And very importantly, when we're talking about all these different risk factors, these are actually shared risk factors for all the NCDs. So the Safeguard Plan also addresses risk factors that are common to cardiovascular conditions, to cancer and diabetes, tobacco, alcohol, and healthy diets, and physical inactivity. And that's why it's so important that we work together. And of course, the implementation, it's crucial. Otherwise, we just have another nice document. We need to do this in a proper way. And this is the implementation pathway that is defined in the plan. We need to improve it. 2026, the EU protocol on health checks and development. By 2027, to have all member states developing the national cardiovascular health plans. By 2035, the targets that I just showed you. And ongoing, of course, multi-stakeholder collaboration and monitoring. Funding mechanisms, this is crucial. Actually, there is no budget for this plan because, again, this is, given back to the different countries, but there is already a few things ongoing. One of the proposed innovative funding approaches is this called the Marco Levi on unhealthy food. Also, EU budget allocations for implementation. There is this 20 million for AI, technical and financial support to member states, but this is something that really needs to be, I think, more clarified. And the collaborative implementation, so success here requires, of course, engagement from all the stakeholders. Everybody has to be involved if we want to be successful. We've mentioned this yesterday. Of course, the European Commission and the member states, but healthcare professionals and scientific societies, and of course many societies are involved, have been involved and are involved and very much engaged in the process. I can speak, for instance, for the European Society of Cardiology, which is doing quite a fantastic job trying to promote this together with the national cardiac societies. And actually there is a program which has been developed at ESC, which is called the Cardio Policy, where different countries also are organizing themselves in terms of following and implementing the plan in an appropriate way. Then patient advocacy organizations, this is what we're discussing here these 2 days. It's fundamental, the involvement of patient organizations, and this is something that is becoming more and more relevant, more and more visible, and thank goodness also, I would say, it's becoming also more and more relevant for different aspects, and particularly for this specific implementation of the plan. And then pharmaceutical and medical technology industry, of course. The expected impact, saving hundreds of thousands of lives annually. That's what we have to, that's the main reason why we need to implement this properly. Reduce healthcare system burden and costs, improve quality of life for millions of Europeans, strengthening health system resilience and equity, and setting global leadership in cardiovascular health. So, in brief, what the Safeguards Plan actually changes, or potentially changes, because we still have to implement it. Well, first of all, political legitimacy for cardiovascular disease investment. I want to change that relationship I showed you in that slide, with Jupiter and the moon on Jupiter for the cancer, and the moon or one of the moons for cardiovascular disease. We need to change that. Framing cardiovascular disease as resilience and competitiveness. Budgetary justification, AI, digital and innovation pathways, and common targets and metrics in cardiovascular health. This is very, very relevant. Now, this is my last slide. This is an historic opportunity we have in Europe, particularly in the EU states. And these are my two last sentences. So the Safeguard Plan represents Europe's golden hour to lead in cardiovascular health and save millions of lives. And the Safeguard Plan in Europe is actually an excellent example of a combined effort of different stakeholders to put in place an organized plan that will improve, hopefully, cardiovascular health for everyone. So from ambition to action, that's, I think, what all of us want, and I hope all of us will be able to, at least the ones who will survive, will be able to watch over the next few years, and I hope all of us. Thank you so much again.
You.
By the way.
Yeah, I'm not sure I'm the best person actually to look at this. I'm not a sports person. I'm not healthy enough with my eating and sleeping and everything. But I think we all have some issues with all these, healthy healthy things that we should do. But when we see this ambitions plan, and it was an excellent presentation of the plan, thank you so much. But what would you think is the most important thing? I mean, for all of us to actually do. I mean, if we are supposed to take action, we're supposed to lead, or at least follow something, that is visible and it's also measurable for ourselves. What is the most important?
Yeah, well, that's the key question, of course. And the issue is, and this is something that we've been watching over a long time. We know in many instances what to do, but we have not been able to translate this in how to do it properly and efficiently. So that's the challenge. I think the main challenge for this plan is implementation, and which is more or less obvious. But that's the reality. How can we implement what we already know? And I've shown you here these 3 pillars, a lot of data there. The question is how we will be able to implement this across the different countries, considering all the difficulties, all the aspects related with implementing something like this plan. And again, we only will be able to succeed if we will be able to put together the different stakeholders that can actually push into the same direction. And that means, scientific societies, that means the local communities, that means patient advocates, of course, very importantly, the decision makers. And this is important because the plan was approved by the Ministries of Health and then by the Parliament. And there was a long road, but there is already awareness now. So now it's very important that in each country, because this has to be done locally, the direction and the recommendations and so on, they are all there. But this to be successful has to be done at the local level. And that's where you need to have the local structures. And of course, there are differences, cultural differences, there are different aspects that have to be also looked at. But you basically need to involve, everybody has to understand that if we really want to be successful and not continuing to see, 1.7 million deaths, 60 million people affected with cardiovascular disease and so on, if we want to change that, that should be something that we have to engage as a society with all the different players, with all the different stakeholders. Now, this needs leadership. You mentioned that, and I totally agree. And that's where in the different areas, in the different groups, and then of course in sort of a concerted action, we need to do our best to promote that and to develop that sort of strategy that can, be successful. We have, there are many indications here, there are many things here that are recommendations but now we need to see on the ground, how this is going to be done and how this is going to be translating into real action. And this has always been the challenge,
It is always a challenge,
yeah.
and the preventive action is always the hardest thing.
Yeah. But the fact that we have the governments involved and approved, I think it gives us at least some hope. Because that's important, if we want to have scale, we need to have the governments involved. We need to have the Ministries of Health or Finances, very importantly, involved in the process. And I think for the first time, I feel that there is some sort of at least minimum agreement. Now, it's going to be all of us that basically will be responsible to make sure that we find ways in our countries to implement that, and of course with some orientation, with some structures that can be more central, some more local. If we are able to overcome that, so Europe can be an example. By the way, we are trying, and now talking as World Heart Federation and NCD Alliance also, in the UN, the New York meeting, there were quite a few documents that have been approved. We are also trying to use this model for the rest of the world. You know, to have sort of a safe hearts plan or a cardiovascular plan. We used to call it like that. Now it's safe hearts plan, as they call it now in EU. Translated also into the different regions of the world. That's even a bigger challenge. But now we are focusing on EU, and that's what we're talking about now.
Well, we have to start somewhere.
Yep.
Yeah. So we will follow up what you have told us and present about the Safe Hearts plan, and it will come several seminars covering also this topic and the coming Swedish cardiovascular plan. So thank you so much, Fausto.
My pleasure.